Hello, my name is Shanaz Aziz and I'm Project Manager for the Changemakers Project, which is a part of a national healthy community collaborative. The purpose of this DVD is to let you know a little bit about the background of the project, what it's all about in terms of why we need to promote early presentation of bowel, breast and lung cancer, to hear the voices of key people involved in the project, and also to showcase the wonderful work that some of the volunteers and professionals have been doing to raise awareness of bowel, breast and lung cancer.
I think what we're talking about was involving members of the public into what you're actually doing. We've always found that that is the one way that people get information.
The reason why we've got this project in Nottingham is because actually it's about improving people's health and well-being. It's about improving people's chances of survival from cancer. And it's about reducing inequalities, because there are certain groups of people, depending on where you live, depending on your ethnic group and other factors which influence your access to services. It's important that through this project we improve uptake rates of the screening programs, but in so doing, what we're also doing is improving people's chances of survival.
Cancer is very important for Nottingham. It's the second commonest cause of death in the city, and there are big inequalities in how long people survive and their general experience of cancer locally. There are two really important things that we want to try and empower communities, especially more disadvantaged communities, with. The first is their awareness of cancer symptoms or possible cancer symptoms, so that they seek help early on, and that they are empowered to get access to primary care and to the help that they need. And that also includes screening, so that they feel that they can take up the screening that's available. The second thing is a greater awareness of preventative factors, because we're looking to the longer term, to the next generation, and we really want to try and make sure that people are able to fully understand some of the things that they can do to prevent cancer in themselves and their children in the longer term.
Looking specifically at the Cancer Changemakers project, I think this is a really good example of how community engagement is working. I know that a number of my colleagues have been working very hard over recent months, getting out there into the communities and bringing together not just patients and the public, but also professional practitioners to raise awareness around presenting earlier in terms of the symptoms of cancer.
In terms of working with GP practices, that's really, really important that we actually engage practices. So initially it was a challenge because it was very, very difficult to actually get practices on board. But once we actually explained the purpose behind the project, we fortunately managed to get 13 practices engaged in this project, all from the local areas that we're targeting. And it's been fantastic because now they're actually sending through monthly monitoring about the number of suspect cancers and diagnosed cancers and cancer spread. So that's really, really groundbreaking, because prior to that, we weren't actually getting that data on all of those 3 specific cancers.
Well, the practice was asked to get involved about 6 months ago, and we felt it was something that was certainly worthy of our involvement. Initially we was asked to provide some data on the various cancers, spoke to the GPs, and they were very keen that we supported the project, and we attended the initial meeting in Nottingham. I recognised that plenty of people were there, and particularly the community was supporting it, and we actually saw quite a lot of our own patients at the initial meeting, and we felt that we'd like to support it.
My role is that I'm the bowel cancer screening lead nurse here for Nottinghamshire, and the reason I got involved with Changemakers is very much that one of the cancers for Changemakers is bowel cancer. And the important thing about bowel cancer is that we need to raise awareness throughout the community, and the only way we can do that is not just by professionals but also by the community themselves, raising the awareness to people around them.
Anne's up then, because on the 6th, remember we was talking about celebrating Volunteering Week in the Market Square. Now that we know that actually things are happening within the area, is it best that we just do the volunteering?
I think the council has. I think you need to get the message across to as many people as possible.
To recruit volunteers, especially looking at the subjects that we're talking, that we're looking at, cancer, bowel, breast and lung cancer. At first you might sort of think, well, it's going to be very difficult to recruit people to come along, to actually want to be engaged, to talk to people within their communities about that. But basically I've managed to retain the volunteers by making things fun.
So how does that work then?
I've got the big connect table.
So it's like
it's the same like that, but the big.
It's really quite big.
The teams have been doing all sorts of creative things. In fact, I think sometimes they often surprise themselves with what they get up to. There's been lots of things, they've sort of developed their own survey that they've then taken out into their communities. They've devised games, poetry, even a drama script to play.
Laughing, Lisa!
Oh, did I skip something?
Time to give up. Well, you almost stopped me then. You think I make a good change maker, Deirdre? Depends on what you're hoping to change. Why? Come with me and I will show you.
I've become a change maker volunteer. Basically, I've had cancer myself, so I know the effects, but I also caught mine very early myself. And I had a very good prognosis, and it's been 8 years now since I had the cancer, and I'm still clear and intend on staying that way. But my mum picked hers up late and she didn't.
I became a change maker by chance really, because someone sent Lisa to see me so that I could recommend somebody else that I know, because I knew I did a lot of work already in the community. And it didn't turn out that way. They didn't put it like that. I thought they came to see me about it, and that's what Lisa thought as well. So I became a change maker through that, but I was willing to do it because I have friends and family who had one form of cancer or another, and I thought it was a good idea to help people realize that they can be cured if they have signs and symptoms of breast cancer or whatever cancer they have, providing they go to a doctor early and get it checked out.
I was on the internet at work and I seen the wanted volunteers, and breast cancer is a big issue, and I wanted to help spread the awareness and the signs and symptoms in the community.
Well, I got involved in this project through a colleague who went to the open day that you had, and felt that because I actually live in Clifton, and I've worked here for about 18-20 years actually in Clifton, that it would be useful and important for me if I joined Changemakers, since because I'm from Clifton anyway, and with all the contacts that I have, would I be interested in that? So I said, yes, please. So I got involved that way, and I'm glad I did.
Well, I was invited to be involved, and as part of my role as a stop smoking advisor, it was considered quite important really to be involved in this new project, because obviously, as we know, smoking has been linked to many cancers, and I think it's important that we work to raise awareness of early signs and symptoms of cancers.